My name is Dr. Jane Goldberg. I'm the owner of La Casa de Spa, and we are here tonight, Tuesday, to hear Dr. Veselin Shumantov, a holistic dentist. And I just want to say that the last contact that I had with him, my daughter had been advised that she should have all of her 4 wisdom teeth pulled. I sent her to a dentist where she's in college and for Invisalign, and that dentist said that she needed to have the teeth pulled, otherwise the Invisalign, it would work in the beginning, but then the teeth would all regress back to the way they were before. And I had been told by other dentists that she had seen, her regular dentist, that she needs to have her wisdom teeth taken out. So I was ready to go with it. I called and made an appointment with a surgical dentist. I forget exactly what they call them, but he can pull impacted wisdom teeth as well as wisdom teeth that have erupted. But I just thought it might be a good idea to check with Dr. Shumantov. So I did. And he said, no. He said something really intriguing to me. He said, when you pull teeth, you destroy stem cells. So he's here with us tonight, and I want to hear all about stem cells from pulling teeth. So here we go. Dr. Shumantov.
Good evening, everyone. My name is Veselin Shumantov, and this is Veselin, holistic hygienist, and I'm a holistic dentist. And as we all know, holistic is about the balance between benefits versus risk of doing something. And since Hippocrates said, first do no harm, nowadays we tend to forget a lot that sometimes doing nothing could be more beneficial than doing something just for the sake of doing it, and we should always consider risks versus benefits. So if we go back to that fact with the impacted teeth, one thing to say is that the deeper a tooth is impacted, the more risks of extraction and the less benefits of the removal. As a matter of fact, there's less symptoms the deeper they are impacted. So it is kind of silly to bother a tooth that is so deeply impacted, which has no symptoms, knowing that there is high risk of nerve damage and virtually no benefits. On top of that, removing healthy bone in order to get there, whereas we, as a surgical dentist and placing implants, we need this bone when we're drilling over this kind of bone to put it in areas where it's needed. And just for removing impacted tooth, you have to remove so much bone.
Actually, you're making me remember, I was told by a holistic dentist about 20 years ago that I had an infection under one of my impacted wisdom teeth, and so she wanted to pull it. And I said, well, what are the possible side effects? And she did mention nerve damage. And she mentioned a few other things like TMJ and permanent nerve damage, not just nerve damage. And so after hearing her describe what the possible side effects would be, I said, no, thank you. But, and she's holistic.
And how did you go with the wisdom tooth?
No,
It's
still
there.
Still happily impacted.
Well,
So, and if there's an infection, which I have no way of knowing, here we are 20 years later, and I'm going to be 68 in a month, and I have been perfectly healthy the whole time.
There you go. As a matter of fact, the risk of permanent nerve damage of a tooth deeply impacted close to the nerve is 10%, which to me is huge. It's a huge risk. 1 out of 10 gets permanent nerve damage for something that doesn't bother you, really, because those deeply impacted teeth usually don't bother people. And the second fact that you mentioned, really nowadays we're focusing on searching for sources of stem cells, which will be the future of organ regeneration, organ and tissue regeneration. And one of those sources happen to be the pulp of a healthy tooth. And one of the healthiest teeth that we have are the impacted wisdom teeth, because they've never been exposed to environment. They still have excellent blood supply. As a matter of fact, there's a company here in New York. It's called, I believe, Save a Tooth or StoreATooth.com. They're actually storing wisdom teeth which are extracted, and it's a stem cell bank, preserving your wisdom tooth for life in case you ever need it. So if you happen to extract it, you can actually store it. But let's say it's about $500 a year. 20 years you'd spend $10,000 for storage. If you need it, it's a good investment, but why do you need to pay for storage when you have a free storage? It's actually the best environment in your own body.
But what kind of stem cell is it?
It's progenitor
It's got to be
mesenchymal.
pretty differentiated already.
Yes, they are differentiated. Yeah,
Yeah.
as we know, there's two types of stem cell.
It's fascinating.
It is fascinating.
So that would be to regrow other teeth or just regrow wisdom teeth?
Regrow tissue. It will be used in the future. This is the trend.
But differentiate it only is good
Well,
for
it
teeth
depends
or
how
it's good for...
differentiated it is. I mean, everyone knows that fetal stem cells are the best because
Yes.
those are so poorly differentiated, they can grow to become anything. So
That
I
is
wonder
true.
if you have stem cells that are extracted from your wisdom tooth, you're saying you can use it for tissue regeneration. That's pretty interesting.
You will be able to use it for tissue regeneration from mesodermals. Probably this.
There you
It's
go. Yeah,
obviously, you
mesodermal.
cannot do any organ, but you can do certain tissues, which is very.
Can you use that wisdom tooth for another person to replace a molar that you removed?
To use from another person, no, because of antigenic factors, there will be incompatibility unless it's a twin from same cell.
Well, I mean, they do use organs.
It would need the conditioning would be so expensive, I believe, and you have to be on immune suppressors. Again, the risks versus benefits. Why would you go through that? Whereas immunosuppressors have their own separate risks and side effects. When you can do a safe dental implant nowadays, and this is one of the subjects I wanted to focus on. It was non-metal dental implants. Since about 40 years ago, more than 40 years ago, we started replacing missing teeth with dental implants, which are made of titanium. And for many years, there were no issues and symptoms when we used pure 100% titanium. In the last probably 20 years, they started creating alloys, adding different metals to the titanium in order to strengthen the material because there are higher fractures with the pure titanium implants. And then suddenly there is a trend of increased side effects and increased adverse reactions to metal implants, which now we're thinking mostly probably related to the impurities in the alloy. There's many other metals than titanium in there, which can trigger even traces of nickel, which can trigger autoimmune reactions.
So the titanium implant is not all titanium. There are other metals in there.
It is not all titanium. There's two issues. One would be corrosion, which is actually applies to titanium as well. And products of corrosion, they can themselves function as a trigger for autoimmune conditions. And separately from that, even if we say titanium itself is safe, the impurities in the alloy, they trigger more reaction, and it's visible with certain implants which have higher percentage of impurities or other ingredients in the alloy. So many people have complained. It's a small amount, but consistent complaints. It's chronic fatigue syndrome, tiredness, skin issues, lack of concentration, people with autoimmune conditions such as multiple sclerosis. And I personally have removed a lot of titanium implants because patients requested, and for certain symptoms, and we obviously follow how everything evolves, and we see a resolution. So that to me itself shows that this is not a hype, is not something which is made up. There is a true connection between those two, and although it's a very small percentage of the people who experience it, those who experience it actually have relief after removal of the titanium implant, and they don't have these issues with the zirconium implant. The zirconium is a non-metal implant. Zirconium itself is a metal which is next to the titanium on the Mendeleev table, but the oxidized form, the zirconium oxide, which we call zirconia, has ceramic properties. So it is extremely strong material. It's used in the aerospace industry as well. for probably more than 25 years, it has been used for hip implants. They have made a lot of zirconia hip implants in the orthopedic surgery field. So this has been studied much longer than in the dental field. In the last 15 years, dentists in Europe started experimenting with zirconia dental implants. And initially there was a high failure rate, which now we know that is related to the surface of the implant, because it was a smooth surface. It's very hard to make it rough, versus the metal. It's easier to roughen a metal, it's harder to roughen a ceramic. So they had failures, about 20% failure rates. Since the companies found a way to roughen the surface, and the micro roughness helps for the osteoblasts, the bone building cells, to attach and start growing bone on the surface of the implant, we see the same success rate as with the titanium. It's in the high 90s. One of the benefits of zirconia implants is they're one-piece implant. The tooth replacement structure, which is based on implant, consists of 3 parts. Implant goes in the bone, that's artificial root. The second part is we call abutment, which is a post connecting the artificial root with the artificial crown. And the third part is the crown, which replaces the tooth that we chew on. So usually it's 3 parts, and between those 3 parts there's always a micro gap. No matter how good we try to seal it, either with cement or with a screw, there is a micro gap, and bacteria can grow within microgap if there is plaque, and there's always a plaque in our mouth. So this has been an issue with the 2-piece implants, which is eliminated with zirconia implants, because they're one piece. The implant and the abutment are all in one, so there's no microgap, and the only additional piece that is glued on top is the crown. And this margin we can bring, this microgap we can bring at the level of the gum. It doesn't have to be way below where the deeper we go, the more dangerous bacteria grow, because when the pocket is deeper, gum pocket is deeper than 3-4 millimeters, then we're getting the really bad bugs, gram-negative bugs. Woods will cover more on that, but that is triggering the bad and acute periodontal disease.
So when one has an implant that has failed, it's because of the microgap?
Not necessarily. It's one of the reasons that causes periimplantitis. Failure can be due to bone resorption, due to the microgap, which is caused by bacteria and plaque. Bone resorption due to overheating during the drilling process, due to general conditions which cause degeneration of bone, and also due to adjacent defects or infections in infected teeth. It can be also due to a bad bite, if the bite was not adjusted properly, due to early loading of the implant or early infection. Pretty much there's so many reasons that implant can fail: bad planning, lack of bone in the first place. But one of the biggest issues is the microgap, and this is common with all implant systems which use 2-piece implants, and there is a certain high rate of failure of the screw which connects the abutment with the implant after certain years of loading, because there's material fatigue. The walls are thinner, there's fractures of implants, which I have seen due to thin walls, and that requires removal.
If there's not enough bone for the implant to be successful, do you use cadaver bone?
There's 4 types of bone that we can use. One is the cadaver bone. We can use autograft from another, own bone from another place. Hip or mandible, the lower jaw.
It hurts.
Yeah.
Well, that's why it's not my preferred method. It's really traumatic, but there's other alternatives. There's ceramic bone, artificial, synthetic, non-organic ceramic bone, and there's also bovine.
When you say failure, what do you mean? Explain failure.
Failure in the old years used to be considered the implant is lost. It's wiggling or it's breaking. Nowadays we consider failure even if we see gum recession. It can be considered failure because it's not only an implant to stay but also to look good. So an implant in the front teeth, which would, let's say the gum recedes and exposes the dark structure of the implant, we can consider aesthetic failure. Although the implant is solid there, the gum is not there, what is the purpose? This is not only for chewing, it's also for smiling and presentation. Especially in the United States, the smile is so important, so that this is unacceptable nowadays.
So failure always means it has to be removed?
No, there's regeneration methods, but it is very hard to glue a tissue back to infected titanium surface. Disinfection of titanium surface is not easy, and the success rate is not that high. We don't see these problems much with zirconia because the soft tissue tends to glue to the zirconia better than the titanium, and we don't see these recession problems. So we don't see the aesthetic failures that are very often and common with titanium.
So I want to ask a question more simple, like to describe to me, because I've never seen an implant done. So basically, you have a post, right? A titanium post that screws. You actually screw it like a screw into the jawbone.
Yes.
Or we'll say mandible and be fancy. So you screw that in there, and you don't want to go too deep because the deeper you go, you're saying more risk of bad infections.
I didn't say that.
Oh, okay. So deepness doesn't matter.
Deep
I thought the
doesn't
gram-negative bugs you were talking about.
That was the pocket, the gum pocket or the periodontal pocket, which is the space between the gum and the tooth or the gum and the implant. If we put a sharp instrument between the tooth and the gum and we probe down, we're going to reach a bottom line, a bottom of this sulcus, we call it, or pocket. If this normal size of the pocket is 2 millimeters, the deeper it goes, the worse bacteria grow. As it goes more than 4 millimeters, we're going to the really bad bacteria, which are gram-negative bacteria, and they cause very severe damage to the
Yeah, I
bone.
know gram-negative. I don't know if they know what gram-negative is. I can tell you all later. But, so you're screwing the post in, okay? And now you have to take a temporary, you said, right? And that goes, like, fits on top of the post. Right? How long does the temporary stay there?
We don't load immediate temporaries on zirconia implants, but once the time comes to load it in 3 months, usually as the soft tissue shapes about another month, patient is ready for a permanent crown. Yeah. When it's front teeth and this is aesthetic concerns, there are other ways to place temporary teeth. They can be glued to the adjacent teeth, or we can make a removable one, or even Invisalign type of retainer with a tooth covering the missing one. There's many options.
Now I have another question. I hope it's not going too forward. If you have a tooth that has cracked and is down to the level of the gum, is it better to try to save the tooth, or do you extract the tooth and put a post and an implant?
If it is broken down to the level of the gum, it is better to save the tooth. We always want to save healthy structure. Yeah, with a crown. Healthy tooth is always the best tooth replacement. Not replacement, but the best thing that you can have in your mouth is healthy tooth. So we put all efforts to keep a healthy tooth until it is feasible to keep it. If we reach a level when it is, again, risks and benefits, if the benefits are less than the risks of keeping the tooth, then we go to extraction. Standard root canals have also high failure rate. 10-year success rate of a root canal is 75 to 80% versus the implant being 98-99%. So this is one of the reasons that we can skip the root canal step, root canal treatment. Another reason is that not quite often we can achieve full disinfection of the root canal system. So many patients prefer just to have the tooth replaced with an implant rather than doing a root canal. There's many situations when it is okay to do a root canal and fill it with biocompatible filler and then save the tooth, but there are also many situations when the benefits of saving it are less than the risks.
And so what about the, for instance, Paracelsus in Switzerland, you know, that clinic? Their theory about root canals, because it sits on meridian lines and then, let's say it's on a bladder or a kidney, and then you end up having organic, issues related to that organ, that it's on the meridian line. And so they think all root canal teeth should be taken out.
Yes.
answer
Do
that?
you want to make a-
Yeah, the whole issue is that it has to do with immunity. So no matter what you do to any part of the body, it has to do with the components of your diet and how you support your diet. If you don't do that, if you're eating, for instance, if you have any procedure and you're eating, let's say, a so-called vegetarian diet, we're not talking about healthy vegetarian diet, the so-called vegetarian diet that a lot of people eat bagels and different carbs, white rice, white flour. And so that's going to create a lot of sugar in the body. And what is that going to create? Inflammation. And what's inflammation going to lead to when your pH is so acid because of the consumption of sugars? Infection. That's the problem right there. So if you, for instance, I have root canal in my mouth, I have an implant in my mouth, but it's what I do with my whole physiology of the immune system. Because, and we're on top of that, we're under a lot of stress, which is another factor. That depletes your system, your nutrients in your system.
Luz, would you please introduce yourself?
I'm sorry. My name is Luz Zelaya, and I'm a holistic dental hygienist. And I'm here to talk about how I learned to become a holistic dental hygienist. I became a holistic dental hygienist because I started working as a conventional dental hygienist when I finished high school, dental hygiene training. And when I started seeing those patients, I would look at the charts, I would look at the x-rays, and then I would see that the charts would indicate that those patients have been coming there 10 years, 15 years, 20 years, 7 years, every 3 months, every 6 months. And they have started with a lot of the teeth, all of the teeth, and I had fewer teeth and a lot of restorative work. So that didn't make sense to me because they taught me in school that if the patient comes to the dentist, the patient goes to the dentist every 6 months, there's no problem. They're not going to have any problems. But of course, if you don't practice nutrition in the dental care, there are going to be problems.
So would you say, it's a question I've always wondered
Yes.
because I have a lot of friends that have implants and extracted teeth and infections and blah, 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 and I've never had anything. And it is true, my diet has been really superior since I was basically 22. So I've wondered, why do some people get a lot of dental problems? So in terms of your implant and your root canal, is that because you were not on a good diet when you got those
Tremendous
issues?
level of stress, tremendous, especially emotional stress, environmental, work-related. My life changed after 9/11, my life changed. It was awful.
So how does one get to the point where it becomes a situation where you need something as dramatic as, if you go to a dentist every 6 months, do you then prevent, and you're on a good diet, do you then prevent ever needing probably root canal implant?
If you know the information, so the beauty of knowing the information is when you know the information, of course. If you know the information later on, if you, let's say for instance, we are here to help the patient and overall. We don't tell the patient, okay, so you have periodontal disease or you have this deep decay and therefore we're going to do the procedure. We educate the patient what were the etiological factors that got the patient to get that situation. And so that's the beauty of what I want to get to talk about, which is what I saw was that when I was treating middle-aged women or middle-aged men, I was seeing a lot of periodontal involvement, gum inflammation, puffiness, bleeding, deep pockets. But I never saw the 25-year-old and under or 30-year-old and under with deep pockets or periodontal conditions. So then I started doing research, and what book did I come across? Dr. Winston Price. So then I started looking at what it is, how it relates to the diet, and he did do the work. He said that he went to different areas of the world and found that in different villages when people were eating the wholesome foods, they didn't have any oral diseases. And people, especially the children that were breastfed, didn't have any oral disease. But he also saw that he also made the comment that he never found also a perfectly healthy vegetarian individual. But now I see why. Because it takes a lot to become a healthy vegetarian. It's not just the food right there. Environments like that probably would be easier in places like that. But in a place like New York, you really have to work at it. It takes a lot. So fortunately, we have supplementation, nutrients that we can take on a daily basis. And that's where I came a pro on, because I can really also learn from the mouth to see what is the cause. Because it's not just about the diet, it's not about hygiene, it's also hormonal related. Because without hormones, you can't make bone. That's the other factor. That's why it's more middle-aged people that suffer from the periodontal conditions.
Do you test hormones?
I only do it like that. I only see it, and I just do all natural, because we have so many natural things. We have maca, we have indole carbonol, which is from cruciferous vegetables. We have isoflavones, we have pregnenolone, we have DHEA. Depending, the only caution with DHEA, of course, if you have malignancy or history of malignancy, you don't want to do DHEA. But there's other things like maca and indole carbonol, which comes from cruciferous vegetables. And cruciferous vegetables, on top of that, it makes your body make your own hormones, and it gets rid of the xenoestrogen, which is from eating from plastics. Also protects us from fibroid and cancer. So it's only a matter of getting that information on time and keep sharing it.
So when somebody comes to your office, they get a double whammy.
Yes.
They get dental care and whole body care.
Yes, exactly. Because it wouldn't make sense otherwise. And for instance, go ahead, you have a question.
No, I had a husband, periodontal disease, bad, loose teeth, and his whole family was like that, and they all died of cancer of the head and neck. There's a nutritionist, Fuchs, her name is Fuchs. Her dentist decided to try a probiotic, Dr. O'Hara's, you've heard of it, probiotic, opened the capsule, took out the stuff, and implanted it in the pockets. That cured her. But I think my husband and his whole family were probably deficient in some vitamin mineral.
Well, when you say that, probably what it means is that the diet got repeated. They were eating the same diet that the ancestors
He
were
ate
eating.
very well and not a lot of sweets. And always took so long in the bathroom, like a half an hour after he ate, he was there fussing.
But so he had
So he took good
deficiencies.
care of his teeth, but still,
But that's my point. So having oral hygiene is very crucial, but
Yes.
what's the most crucial part of the whole equation?
What do you-
Immune function.
so what do you think about probiotics?
Probiotics
A
are
good
great.
probiotics.
However, the way I treat periodontal disease, because when I get major severe cases of periodontal disease, which is a type of infection, by the way, what I do is I have a whole protocol that I devised, so I developed it throughout the years, and I put patients on super nutrients that are garlic, strong garlic supplementation. I make sure that I tell them that there's no sugar consumption, and otherwise they're going to get abscesses. That they have to really do an alkaline diet, and I go through what that entails. High fats and the vegetables and good sources of protein, and also periodical consistent detoxification. Because if you don't address the foundation of your immune system, which is in the trunk of your body, you're diluting yourself. You're not really absorbing what you're putting in your body. So you're wasting your money. So the whole point is that if you look at the mouth and you see all this infection, the redness, the puffiness, the bleeding, and you know where it's coming from. You know it's coming from the gut. There's no two ways about it. It's a component of many factors. And on top of that, sometimes mercury in conjunction, mercury toxicity. So that makes the whole situation worse, but not undoable. The point is knowing the piece of information. So you put the patient on high doses of vitamin C, which is going to create healing of the inflammation, the garlic, which is going to heal the infection, the essential fatty acids, coenzyme Q10, which is going to boost the immune system, the minerals, and educating the patient that they have to stay away from refined carbohydrates, which is going to become sugar, which is going to become inflammatory, which is going to become acid, etc.
Do you take any blood work or recommend any blood work be done to see about their deficiencies?
We actually don't take blood work there, but we send for blood work. Yeah, for deficiencies, also for tests for reactivity towards metals, which is MELISA test, and also you can do biocompatibility tests for dental materials.
I think I drew blood from someone for that, didn't I, James?
You know that you can't do Clifford's test from New York City or from New York State, and my friend has been using Clifford for many years, and so Dr. Gale very generously agreed to centrifuge the blood in New Jersey so it could be shipped from New Jersey, and so she was
Oh, I
able.
drew it too.
Yes, you did.
I drew one, I drew it, and spun it down.
But I was leaving that part out because you drew it in New York.
No, no, we
Clifford,
can say that. No.
don't listen to this, Clifford.
It's being recorded.
But I wanted to talk on one particular case because there was a lady here that was talking about her grandson. I would like to talk about that particular case and another case that I have in mind that it was great. The first case actually was an adult, this woman, and this was in the beginning of my career as a holistic practitioner. And this woman was having issues with her gums. I came to work at that office and I saw her the first time, and I said to her, "You have periodontal disease," and she wasn't even aware that she had periodontal disease. So that I went over the whole scenario about how one thing affects the other, and how metals also is another component of immune suppression, and also that if hormonal are not in check, you're going to lose.
And I'm sorry to take you
Yeah.
astray, but also the metals and different metals, and they're conflicting with one another
Correct.
is often a problem.
Exactly, it makes it worse. So then, so I went through a whole regimen with her, to clean up her immune system somewhat, intestinal, liver, and also the diet and a protocol of vitamins and hormonal support. And so hormonal support, I only use, like I said, vitamins. I don't use any other prescription, or I don't use prescription. I'm a dental hygienist. So then point being is that, of course, I'm not supposed to do vitamin C either. I think you guys know that. But I do what I'm supposed to do, and I say, God bless me and help me. But the point being is that this lady was losing her hair. And so she was probably at the time, she might have been in her late 50s. And she, 3 weeks later, she came back to the office, and as soon as she walked in around the door and by the desk, she couldn't wait to see me. She said, "I gotta talk to you." And she said, and she couldn't even wait because I was busy. And she said, "I gotta tell you, my teeth are not moving, my gums are firm, my gums are not bleeding, and my hair is coming back. Hormonal in toxicity."
And what had she been taking?
She
Thyroid? What
She
kind
wasn't
of,
even taking anything. She thought that it just her diet.
just her
That's what-
diet changed?
Yeah, her diet, I modified her diet. I gave her the supplements that I have mentioned. Maca, the indole carbonol, which is a cruciferous vegetable form of supplementation, and the vitamin D3, which is very essential, vitamin magnesium, the minerals, and the essential fatty acids, and to do some detox. The next case that is a really wonderful case was a 5-year-old child that the mother had taken this child to 13 dentists. And after being just like, she didn't know what to do, she talked to her child's classmate father, and he said, "Are you kidding? Just take it to this woman, Luz Zelaya, she'll help you." And when I saw the child, I saw that the child had cavities all over his teeth, and basically she had been told by everybody that they needed to do pulpotomy and aluminum crowns. Pulpotomy is like the equivalent of root canal. So after that.
In baby teeth, no less.
Yeah. So then I said to her, "Look, this is not about hygiene. This is about his diet." So I asked her but I already knew, but you had to get this on the open so that she would know that it was the diet that was doing a number on the child. A growing child, more than anybody, needs protein and the vegetables and all the various minerals. And so we went over there. I dissected what he was eating, and I went over with her, and I said, "We can do this, but I need your participation 24/7 because otherwise he's going to be eating candy or something's going to happen. So of course we did it. The child never had pain. The child never had any restorative. I never told even the dentist because they would have said I was crazy. It was not Veselin at the time. And so the kid is now 18 years old. He never had an invasive care. And that the thing is just to knowing the little piece of information that makes the difference. When you don't know, you're like blind.
It's really we do. The body knows how to take care of itself. We have to give it the right, give it
support,
the right ingredients. Yeah.
That mother is to be commended for going to 13 dentists. 13? I kind of one of my scariest things was a year and a half ago. I was looking for a new dentist. I only went to 4 of them till I found a dentist. But after seeing 4 of them, I became convinced it's like a Wild West out there. and seeing 4 people, and I actually even brought dental x-rays and other things there. I don't want to get into more of it, but 4 people, 2 of whom said they were either naturalistic or holistic or something.
Right.
I had opinions or treatment plans ranging from 7 or 8 wisdom teeth problem and taking out wisdom teeth, maybe some changing them to crowns, maybe some root canal work, and prices, without even talking about taking out mercury. That was another talk, but just on that. 2 of them were giving me price ranges about $12,000 and messing up wisdom teeth, whatnot. One of them, who was crazy, was coming in about $4,000 or $5,000, but you're supposed to sign in the beginning saying that you agree to all the treatment and you can't back out and pay up front. Other things were just, so I thought, what if you didn't like the person? And then somebody else was a few
And
$100.
suppose he dies in a car crash.
I guess your estate would have to pay, I don't know. Plus the office wasn't terribly professional, but anyway. Then one other person's giving me, saying, oh, you just have a few cavities, a few $100. Said, you know, you have nice work in your mouth, don't let anyone tell you anything different. Plus, one of the wisdom teeth had a cavity. One person said, well, we've got to pull out the wisdom tooth, might need a crown. And I said, well, couldn't you just fix the cavity on there? And the person says, I don't do patchwork. The dentist I wound up going to said, oh yeah, and explained, yeah, there's a cavity, but it's not crossing the midline. We can fix that cavity without messing with the onlay or anything else. But, you know, what's the patient, what kind of tipped the balance for me is one of these ones who said they were holistic or naturalistic was saying, I start off with deep cleaning. And I said, but I've been going to a periodontist regular visits. The periodontist does just a little bit of work, doesn't say anything. And she says, no deep cleaning. And I said, something's not adding up.
Right. This is what the perfect time to say about our work relationship, that what we do is that we always talk to each other about the patient right there in front of the patient. We just don't. He doesn't make assumptions and goes out. We always, because it's 2 heads, we're sharing 2 heads, and we have years of experience in the field. So we both, and I never had that relationship with a dentist before. It was like, it's like it is what it is, and we have, and that's wonderful because the patient, like you were saying, gets 2 pieces of, what did you call it when they come to see us? I don't know the word you used, but point being is we talk to each other back and forth.
Double whammy.
Double whammy in front of the patient, showing the X-rays. He does the X, like not like this, 1, 2, 3, and he shows it in the screen right there to the patient. It's wonderful.
But even with the X-rays, on my X-ray, and I brought in X-rays, whatnot, and one is showing me, see this, and I even marked and counted them, wrote all the things down. Once I see there's this shadow, there's a deep decay, and then my periodontist said, look, based on the angle of these X-rays, that shadow might not mean anything. You have to confirm by clinical exploration.
That's true, always. There's no one method which covers 100%. X-ray don't cover everything, exam doesn't cover everything because there's areas which you cannot see. That's why they complement each other. And so they always have a few methods to be used, absolutely. And as Luz mentioned, we work together as a team. It's a teamwork not only between me and her, but it's between me, her, and the patient, because the patient is the one who makes the decision. We can only make our recommendations. So we can create different treatment options plans based on the desires, priorities of the patients, time, finances, but ultimately you want to find a balance between the optimal solution based on multiple factors and priorities, really.
This is not going to be a question that you're going to want to answer, but your point of view is so different from traditional dentists in this country. And I know you have trained overseas. You mentioned you were in Germany a few weeks ago. Why is dentistry in America so wrong? What happened?
I wouldn't call it wrong, but here what I notice in this country is that it's not only in dentistry but in every business the goal is to establish a path from where you don't move left and right, because it's easy once it's established. If it's proven that it's working well, it's economic, because the more varieties you have, the more steps to the left and right. It's going to cost more, even for education of this dentist or things like that. So always every business here, I see that it works straightforward at path lines, and this is dentistry is one of them. So there is recommendations for this situation. This is the best treatment, and not many alternatives are considered. Many times they offer treatment options, but it's not really analysis of the situation along with the patient. There is less communication. I believe there should be more communication between the patient and the dentist, rather than being one-sided relationship.
So, I'm sorry.
Are they more innovative in Germany, and do they use a lot of lasers there?
Lasers are used in the United States as well as in Europe. I wouldn't call lasers innovation. They've been out for many decades. But what is true for I'm from Bulgaria, Eastern Europe as well as Western Europe. In Germany, it's you are more open to try conservative and different treatments, and here, because probably for liability, dentists are always sticking to the most traditional method, which has the longest track record. So, for example, zirconia implants are not popular because they have a smaller track record. It's 10-15 years versus 45 years. But when I see the evidence out there, I had no doubt that this is the right way to go. So why would we have to wait another 20 years to start using them when the evidence is out there? I think European dentists are more willing to try and explore. Yeah.
Last weekend I was a speaker at a holistic health conference, Mondo Well, and I met a dentist there who calls himself the ozone dentist. I'm interested in ozone because at my spa we have, back behind here, we have an ozone generator and we have a steam cabinet, and we get fantastic results with people for all kinds of afflictions with ozone. So I was interested that he uses ozone pretty generously in a lot of different conditions. What do you know about? I know they use ozone in Germany like crazy. Mm-hmm. So what's your opinion about ozone dentally?
It is one of the best disinfectants. It can kill bacteria in the cavity, and if it's a small and initial level of cavity within the enamel, it can actually prevent drilling.
And do you have ozone available?
Yes, we use ozone for certain situations. It can be used for periodontal also.
Yeah.
But it is not something that I rely on 100%.
Yeah.
And I say, in my opinion, the reason being is because I know, for instance, of cases of patients that went through this particular doctor that implemented that. In my opinion, way before that was that you can't treat one part of the body if that's the cause of the problem. So it doesn't make sense. It's going to help in the immediate moment, but it's not going to last. So the point being is that you always have to look at and view the whole organism. You have to. That's why I did love. It may sound boring, but I do like garlic tablets because it treats the infection systemically. So it's gonna manifest everywhere. If you do ozone in one part of the body, I mean, ozone is great. I know what you're talking about because I used to have ozone in my office to breathe good air. But it's the point that what I don't agree on is on treating one particular area as if that's the root of the problem. So that's going to help the patient immediately, but to sustain that, you need to address it systemically.
You said that with the ozone, you might not have to drill in certain cases. Is there problems if you do drilling?
Well,
Or should drilling be avoided if possible?
it can be avoided if possible,
I
but
mean,
it can
and why would one want to avoid drilling?
to preserve tooth structure. Now we're talking about minimally invasive dentistry. The more tooth structure you preserve, the better long term for the tooth. So that's this can be achieved with other methods as well. After ozonation, the actual cavity can be sealed again without drilling, just with a sealant or a flowable composite, which is a liquid composite, something that can be placed there without drilling the tooth. But these are cases for small fillings, for small cavities.
So I went to a dentist that I hadn't been to in many years, and she, a hygienist, she, just for cleaning, and she used, she didn't do it by hand. She has a machine, I think it's, yeah. Tell me about that, the difference between that and doing it. Does that affect the brain?
Well, possibly, but at minimum. But the point being is not even that. It's what kind of cleaning you got, because that is an what's it called? What's the cavitron?
Piezoelectric or magnetostrictive?
I think it's sound.
Yes, ultrasound. Therefore, you cannot use it what they call in dentistry subgingivally, which means you cannot use it below the gum line. So if you only use that equipment in cleaning, I don't believe that you can get. I mean, I know that you cannot do a thorough cleaning. I mostly do it by hand because that's the thorough cleaning. I use the cavitron when I want to make my work easier, and then as a first step, and then I never not use my hand instruments, never, because then it would not be thorough. Because you have to go below the gum line, which is the sulcus, so below the gum line. Especially when you have packets, you can't use the cavitron. You have to go with the hand instruments. And again, talking about what I was talking about, the holistic approach implemented in dentistry or in dental hygiene, as in my way of doing it, is that the beauty of getting this type of care is not only that you get health, but you also get beauty, because you start cleaning up your whole act, and you become beautiful because you support your hormones, you get firmness of the skin, and you retard aging, and you prevent disease. That's the only way to go.
Sounds perfect.
Any other questions?
Do you go to the dental convention every year at the Javits?
I do go, yeah.
Yeah.
I go to many conventions. Javits is one of them.
I don't think they discuss holistic
They
dentistry
don't.
at the Javits,
Never.
at the dental convention.
They don't. But this is one of the places you can see all the new equipment that comes out.
The materials.
So we just want to stay updated with what's going on in the field in general, not only in the holistic
So
field.
what about overseas in Germany or Russia, or when they have a convention, do they discuss?
Holistic approach?
Yeah,
Yeah, these are two separate issues. The conventions that they have in the Javits, they have it all over the world because the companies that manufacture
Yes.
those equipment sell it all over the world. So there's types of conventions. We shouldn't talk about locations, but about the type of conventions. So I'm a member of the International Academy of Ceramic Oral Implantology, which is one of my favorite conventions to go to, where we discuss holistic dentistry and in specific zirconia implants.
Which one is that?
International Academy of Ceramic Oral Implantology.
Ceramic oral.
Ceramic implants.
As
Yeah.
opposed to metal.
The
As opposed to
zirconia.
metal.
So ceramics is, but that's not the zirconium, that's something else.
It is zirconia. It's zirconia ceramic. The zirconium oxide is a type of ceramic, the strongest ceramic available.
Is it diamond?
It is not diamond, but it is a material which is weaker than diamond, but it is stronger than anything else actually. So,
Why-
by the way, one of the issues that people, questions that they had was because it is so strong, does it actually wear off the opposing teeth more than the porcelain teeth that we put? And the studies show, surprisingly not, it's less, it wears the opposing teeth less because it's highly polishable. It's been polished to a higher degree than the porcelain, so the abrasion doesn't come from the hardness of the material, but to the level of polishability, of how polished it is, how smooth.
What's your opinion about removing mercury? Do you think it's always necessary?
Necessary is a word that I wouldn't use that word. It is a question of first what is the situation with the whole body and the immune system at the moment, and how large is the filling, how many of them, and what is the risks of removing versus the risks of staying in the mouth. And I think you can say more
Yeah,
about it.
there's times where you see that it's absolutely necessary. I mean, I have seen, there's a case that a patient of mine has been my patient for 25 years. And she's a doctor of homeopathy, and I was telling her from way back to remove her silver fillings. And I don't want to say that it's coincidental, but she did get breast cancer and other cancers years later. And she's a true, but she's a fighter, and she did a lot to stay healthy, and she went through a lot. And so she finally now wants to remove her silver fillings. But to answer your question is based on all the studies that I have done, the readings and all the experience that I've done with patients, I would say that my statement is that I definitely think that mercury I agree that it's a poison. I didn't come up with that. I agree from what I read and I've seen clinically. So I have 30 years of clinical experience. I've been seeing patients for more than 30 years. So I've seen how they either get affected by the thyroid, or it's one thing, or it's or skeletal health, arthritic problems, assimilation, high blood pressure. There's a number of conditions that can develop from being poisoned with mercury.
Do you have a way of determining whether the mercury is actually exuding and thus causing a
My
problem?
way is it cannot be recorded, because my way is I look at it and I know. It's just that one is I'm very intuitive, and I know exactly what is the picture.
So even though there may be no symptoms, the person
no, there
presents
are.
no...
Oh yeah, but there
If the person is presenting no symptoms, but they still have mercury in their mouth?
there are subtle symptoms that I detect. It doesn't have to be major.
Like what?
Like the person could say, for instance, my memory, the person probably not even know that my memory is blah, blah, blah. Or my energy is blah, blah, blah. What does that tell you? It's affecting the thyroid. So it's not really like you could see it clinically, but you know that those conditions are affecting such an organ. If you know the thyroid, one of the functions of the thyroid is metabolism, energy, hearing, memory, all that.
If there's mercury leakage or problems caused by mercury, could something be detected in blood work?
Of course.
So if a person had blood work and came out without a problem, does that mean they weren't aware of specific symptoms? Would that mean you could probably leave things alone?
Well, some conditions are asymptomatic. That's why it's very important to listen to your body. But some conditions are asymptomatic until they become subclinical.
So the blood work wouldn't be definitive?
Not 100%, not always. Because it also depends on the reader, the person who reads the blood test. I mean, if they bring me the blood test, I would say certain things are they're not straight, something's off, but that's not my title. So I have to be cautious the way I talk to the patient. But they trust me so much that I said, look, it's not my place to say such, but this is my take on this. And what I have done, which is very non-invasive, is zeolite. So I come up zeolite, which is a mineral from lava from volcanoes. So when they have noticed that when they take the zeolite, they feel the difference. So that again right there, there's a person that I've known for an elderly guy, a person. He's in his 80s, and I could feel I was, you know, I could see that he was dragging, and he had been going through the Presbyterian hospital to have chemotherapy and radiation. And I'm saying to myself, oh my God, but he was not my patient yet. So, but I know the families, I know the couple. So then so I'm saying to myself, one day finally he came close to me and I said, mercury, that's what's affecting him. But I didn't tell him. I told his wife, I said, you know, I think definitely that's what he's going on. That's what's going on with his health. So he came to the office, and you know, we both saw him, and he's doing the zeolite, and he really feeling much better. And he's in his 80s.
Zeolite is a tablet, or?
It comes in powder or in liquid. The best form is liquid.
And it neutralizes
It
mercury?
basically
mercury-
flushes it out through the urine. And so even though it's still in the mouth, what it does is that it relieves the body from the overload of metals.
You're actually using the zeolite as a kind of diagnostic tool.
Not really, because
Well,
I can
if they feel better
no,
from the
that proves
zeolite.
it basically.
Yeah, that's what I mean by
but,
diagnostic.
But there was another person that I knew. He was about 29 years old, about 5'11", well fit, and he says to me, "Do you have anything for blood pressure?" And I said, "For you?" And he says, "Yeah." I said, "Can you open your mouth? Load it with mercury." So these are the things that you get to learn, you know. And Dr. Weston Price did that work also, and Dr. Hal Huggins, which got beat up by everybody, as you may know. What's it called? It's All in Your Head. It's one of the books that he has.
Mhm.
So it's things that, you know, that the FDA and the Dental Association are going to support us on. We know. But we do the best we can to help the individuals. That's all we can do.
So I'm feeling fairly convinced that I should have the rest of the mercury taken out. The holistic dentist that I mentioned before that I had seen 20 years ago, I think she did 3 quadrants, and then I developed such a severe case of TMJ, literally it has ruined my life. Not really, but I mean, I've been in mouth guards ever since. And so in mouth guards, my head didn't know where it belonged on my torso. My TMJ was so bad, induced by the dental work. One time she kept my mouth open for 3.5 hours.
That's ridiculous.
Yeah. The next time for 2.5 hours. So
I just left a client who was in the dental chair for 6.5 hours. 20 years she's been plagued by the results.
yeah. So I'm interested that you said, when I used the word necessary, you said you didn't like that word so much, that you would weigh risks and advantages. And so I'm wondering, I'm not hearing any risks from Luz. So I'm wondering if I decide to have the rest of my mercury taken out, what might be a risk? Other than the re-stimulating the TMJ.
But there is a process. There is a book that also Dr. Hal Hogan wrote. It's called From the Frying Pan to the Fire, something like that. Because people thought when they found out that information that they should just go and get everything out. Get it out of my body. I want to be healthy. The wrong thing to do. That's the whole key piece of information. You have to know the procedure, the process, and the steps in which the whole procedure is conducted. So basically, what we do is we talk about it, and we 1 tooth at a time, and let the person rest for like a few weeks, and the person is doing zeolite, and that's the safe way to do it. You don't drive the patient crazy and let's do this, da 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 da. It's the wrong thing to do.
One of the risks of removal of large amalgam is that very often you may damage the nerve. Is it overheating or removing extra structure, but you're getting closer to the nerve? So one of the issues is that patient comes back, may say that tooth is hurting now, I didn't have pain before, now you need root canal or extraction. That's a risk of removing a large amalgam filling. So yeah, it needs to be considered. Of course, the high amount of vapor, if there's it hasn't been done in a safe way, then it can be inhaled and increase the amount of mercury actually that you have in the bloodstream.
So now, many of us know not to let mercury be put into our mouths. And for, I guess, large cavity things, there's onlays, inlays with, I guess, gold is the best.
Mm-hmm.
But for smaller things, what what's the best thing to take care of small cavities?
We use composites.
That's the white stuff?
Biocompatible composite. Yeah, there are composites which do not contain. The standard composites contain monomers which.
Contain what?
Monomers or plastics which have higher toxicity than other composites that has been developed, such as diamond crown, which have lower toxicity. So, I mean, every material has certain toxicity, right? So we cannot look for absolute zero, but for something which has minimal influence. So diamond crown is one material that is most biocompatible from the composite materials, from the white resins. Another thing for onlays that we can use is zirconia or porcelain. Gold is something that is from the metals. It's probably the best thing to use, but it's still a metal, so I would rather use porcelain or zirconia than gold.
Why? Why not use the metal?
Because it is metal that will be releasing metal ions, and it is actually the best metal around gums because it supports gum health.
The gold?
Yeah, if you have to have a metal, it should be gold. But especially if there's more than one metal, if you have crowns with other metals, again, we're coming back to the galvanic issues, microcurrents, and things like that.
And how do you handle that if somebody comes in with different metals? Do
You
you?
have to eliminate either all of them or at least all of them except for one, and
Yeah.
you leave the gold.
And you do that. You
Yeah.
take that very seriously, that there should not be that incompatibility.
They should not be, yeah. Some people feel symptoms and some don't. But the ones that feel the symptoms, obviously, we would like to address them because this is an issue. And the ones that don't feel the symptoms can be just informed about it and know about it, and they can do something about it or not, but at least they know what is the potential, what potentially is going on in
Is
the
it
mouth.
incompatibility if gold is made from different labs, or if it's gold and then the incompatibility is different golds, or gold and then different other things?
It's not about the lab, but the alloys. So there's alloys with certain different percentages of gold, and it's not only gold. Some of them have palladium and platinum. Often you have mixture of metals. So when they're within the same alloy, it's better than when you have them in the two different parts of the mouth. That's when you get the microcurrents running and possible symptoms.
What's the deal with titanium, and are there different qualities of titanium?
Yeah, as I explained in the beginning, not the actual titanium, but the titanium alloy. There is a difference. What they're using now is type 5 titanium with higher percentage of other ingredients, aluminum, vanadium. So, yes, when you have titanium implant, then you have a different type of crown on top. If it's metal porcelain crown, it's usually made of metal which is not titanium alloy, so it is a different metal, or it's a gold crown. I consider it an issue, that's a possible issue for galvanic currents, microcurrents.
So, given that I've had this TMJ issue for 20 years and I wear a night guard every night, I wear metal in my mouth every night.
What kind of metal do you wear in your mouth?
The mouth guard is made out of metal and plastic. The
Well,
metal is what
Looks to be
holds it,
Stainless steel.
but that's metal.
Yes.
Am I pulling in all kinds of horrible energy into my head?
You get a
Again.
different kind of night guard probably.
You can get a metal-free night guard if you want to be metal-free. Yeah.
This one is actually, I don't think for this particular system, they make metal-free. I did have one at one point that was metal-free. This one now is for facial redevelopment. Do you know what that is?
No.
I'm not sure I'm knowledgeable enough to talk about it, but
It's a company called Facial Redevelopment?
no, that's
It
the,
widens the jaw. It actually widens your jaw.
But that's not a night guard, that's active appliance, there's a difference. When you mention night guard, that's a passive appliance, it's a retainer.
Yeah, it's an active appliance.
Active appliance, then you can
It's-
talk about facial redevelopment. It can open the palate, split the palate open and make it wider.
that's
move the jaw
only,
forward and back.
I haven't been opening my palate for several years now. That's only one thing that it does. It also has something to do with what's the tract that the oxygen comes in.
Glands.
Pharyngeal.
Yeah,
Trachea?
I don't know enough about it to talk about it intelligently, but in fact, I have before and after pictures, and in fact, my face has changed from this. That, you know, this is higher, and
But does
my
it
face is.
support, does it keep the muscle, the soft tissue away from your teeth and jaw, or what is the principle of work? Because there's appliances which change the balance. Obviously, the muscles around the jaw are creating pressure inwards, and then if we eliminate this pressure, then we allow the jaw and the teeth to expand. Also, this factor also is working.
Well, rather than talk about what it is that I don't know, tell me about the medal I'm wearing every night. Is that a problem?
I wouldn't say this is a problem. It is only a problem if you feel symptoms.
That's what we say.
Yes.
Yeah, what you want to do in that case, you always want to really listen closely to your body. You'll know. If you go inward, you'll know. But how long have you been wearing it?
You've convinced me that I may be, in my mind, asymptomatic, but in fact, getting into trouble in the future, like your patient that got cancer.
But in that case, you could easily use zeolite. There's no problem. If you use zeolite,
Zeolite will
Zeolite,
neutralize the metal.
flushes it out.
Just because it
Yeah.
flushes it out.
Detoxifies, takes it out.
Right.
Is zeolite the main system that you have for detoxification? Because
For
we
metals. Well, that's that's the main one, really.
Sounds
Yeah,
good.
yeah.
Simple.
we at La Casa really believe in detoxification. Most of our therapies here have to do
Right.
with detoxification.
And
But then you have
another
to keep
principle.
taking the zeolite.
Which is not a bad idea because it does other good things too. It improves your digestion. Because it's good for the pH. It gets rid of yeast candida. So it's not a bad thing.
And I just wanted to mention another principle that is very simple and easy to use is when you have a choice, pick the one that works better for you. When you know there is available metal-free alternative, it is more biocompatible, then just pick that option. When there's no option available, then yes, you are ending up choosing the one which has negatives or no treatment.
When I come in to get the rest of my mercury taken out, I'll bring in my appliance. You can look
Also,
at it.
yeah, but also remember that lady had mercury. Mercury. Amalgam. Silver fillings is
Yeah,
mercury.
I still have mercury.
No, but I'm saying your appliance is not mercury.
Oh, no, right.
So now we have all of the galvanic.
Yeah.
Let me ask about TMJ. In looking around maybe a year and a half ago, so a year ago, for a new dentist, one of these people was moving my mouth all different kind of ways to supposedly check on something. So I didn't see the point of all that, but I didn't stop her from doing that. Then maybe 6 months later, a few months ago, I have like a little something,
Clicking?
no, just
Tension?
I know, a stress thing right here, would that be like a beginning TMJ or what is? I mean, like a little, I wouldn't even say pain, a little bit discomfort occasionally. Here, it's sort of something with moving the jaw, like as if a hinge or something. Could that be that in this moving, she sort of started some process that wound up wrecking things or wearing things
Or
out?
if she did it months before you start feeling this, probably not. But yeah.
I would say that if you took like 300 milligrams of magnesium glycinate, that would help.
Do I take magnesium with calcium in general,
No, but I'm talking about magnesium. Magnesium by itself.
without the calcium?
Yes. For that reason.
Yeah. How often or?
I would do it twice a day, every day. Magnesium is great.
Well, I mean, it's the calcium, I take,
But we're not talking about calcium supplementation is for skeletal health.
right, but
And
that has
magnesium-
magnesium with it, it's a combo.
Magnesium by itself is a whole different ballgame. It addresses sugar, it's for spasms, for cramps, it's for cardiovascular, for brain function, for tension. So it's magnesium by itself it plays different roles in health.
Luz, I have read that magnesium is very relaxing, and we have a float chamber here at La Casa, and it's filled with 800 pounds of Epsom salts, so it's basically a magnesium bath.
There you go. Yeah.
And I've noticed that, I mean, I know they make that calm,
Yes.
powder, and it's magnesium, and it's supposed to help you to sleep. So also the reading I've done on magnesium is that you absorb it better when it's transdermal. So I put magnesium on my body, the
Nice.
magnesium oil. But
Uh-huh.
what's interesting is that when I do it before I go to sleep, I can't go to sleep. It has the opposite effect on me.
Wow.
Interesting.
So I put it on when I wake up.
From what Jane is saying with magnesium oil, right, at this part here,
That would be great. The price would be
Topical.
great. Yeah. I would do that. But I believe in doing, I heard that magnesium oil gets absorbed very well, but I've been using my magnesium in tablets for a long, long time, and I use it with my patients. And then we get great results.
Magnesium oil feels sticky, maybe that's
Yeah.
what keeps you up.
It feels disgusting, actually.
Actually, that's one of the main supplements they use in Europe for high-end athletes to recover.
Oh, yeah, magnesium. Yeah.
Magnesium recovers the muscles, and if this is a muscle
They
issue-
do it IV?
No, they take supplement. They
Uh-huh.
take magnesium
Uh-huh.
tablets.
Well, I don't know if it's a muscle or how, like knee joints and things, joints wear away.
Joints and
So-
muscles.
That could be an issue too.
But then, if I was gonna do magnesium separate from calcium, if I'm doing the calcium twice a day, I have to then space these things out and get into all kind of permutations of how much time to leave between.
Not a
Don't
big
make
deal.
yourself crazy.
I know, the more you try for
Just
health,
when,
you can
if you notice it, you think about it, do it. I'm ready for some magnesium right now.
Does that mean you're about to fall asleep, sitting
No.
up?
No, that would put me to sleep.
I thought you wanted help to sleep.
My body's sore.
Oh. So is there any questions that we may answer? As far
Sorry
as,
about the white, you said the white composite with diamond crown, white, is that something that, in general, most dentists, you could say, well, I want this particular white composite, or most dentists just have a certain kind that they use and they don't deviate from that?
No, I think most dentists use whatever is available on the market, and if you want to use this material, it's available for any dentist, but they don't know about it. But-
So wouldn't even, so suggesting it to a dentist and then they're using, even if they said okay, but they didn't know about the product, it might cause more trouble than.
I have some information on that, since I have a friend that's seen
Yeah.
every dentist in town practically. And she insists on only using Diamond Crown. And there are not too many dentists that know it and use it, and she's actually trained some by insisting that they use it. And some dentists will not use it because they say they're unfamiliar with it and they're not comfortable with it.
It's a personal choice. I mean, when you know something is better, I would say get trained and use it.
Yeah.
It's not you, it's the patient they're doing it for. So it's not about how easy it is for the dentist. It's service for the patient. What is the truth probably is that they don't believe.
Yeah, I think traditional dentists are just not open to, I mean, even this biocompatibility issue, it's just not something that they think
Right.
about.
right.
Yeah, it's not taught in dental school, so until it gets into dental
That's-
school, they will never.
Yeah.
That's the problem right there. It's not
Yeah.
being taught. It's like how I integrated what I do in dental hygiene.
Yes.
If forget it. I mean, 3 times they tried to revoke my license.
Really?
Yes.
Why?
And because of what I do. But they couldn't get me. They couldn't get me. That was very funny.
And
Okay.
you're doing the things the right way.
We're not
Because-
challenging them right now and saying, Luz, come and get me. I'm ready for you. We're not
No,
saying that.
No, of course not. But point being is that because there are people that have different agenda, people that don't, when they don't, that as you may, I think you said, somebody, when you're not up to something, you're down on it, and so you put people down instead of like learning, embracing it so that we can help more people. That's those type of individuals.
They feel threatened.
Yeah, yeah.
Can you recommend a zeolite? Because when I did a little research on this, a year or two ago, I found there were just there's so many companies and so many different things available. And I know you said liquid zeolite,
There
and
was
I think
one
you also
company
said
that got
vitamin
into
C.
trouble because they had
Is that right?
some bad component in theirs a couple
I've
of
been-
years ago.
Yeah, I've been using one that I met this lady, well, I haven't even met her, only on the phone, but she's very nice. I get it from California, and it's in liquid form. I can give you my number and I'll give you the information. Yeah, and I can get it, or you can get it from our office too.
Okay,
Yeah,
great.
yeah.
And my understanding is that the studies actually that show the effects of zeolite were done on the powder. So the people that sell the powder insist on making that point and tell you that you should be using the powder. But I know there are some good holistic people, like Gabriel Cousins, I think, makes a zeolite liquid, that really believe that the
Yeah,
liquid is
yeah.
more absorbable.
And I tried the powder also.
Uh-huh.
I like the liquid also.
Uh-huh.
I had one particular patient. It's an interesting case too. She was in her 80s, and she started getting. And I have been telling her to try to do something with, because she had a lot of mercury in her mouth. And I was looking all the time ahead of time, but she was the type of person that she didn't want to, because it can be invasive when you're removing silverfish. It can be, especially for an elderly person. But so finally she let me get the zeolite for her. And she was having pain. She used to jog all the time, and she was having pain in her joint. And I thought to myself, she's doing everything, because she was doing a lot of vitamins, and she was slender. And so I said to myself, I bet you it's just the mercury. And that was it. When she took the zeolite, she was back to normal.
And zeolite is good for all heavy metals?
Oh yeah.
Uh-huh.
Yeah.
Lead?
Like the metal you have?
No, I actually have a system that's a frequency reader. It reads vibration frequency,
That's nice.
and it scans the whole body. It's Russian technology. And I saw someone today, and I looked inside her blood, and she was really overloaded with lead. And she had been complaining she came because she has symptoms that, they're kind of vague. I don't feel right. I'm tired. I have numbness and aches, and I've been using this system for several years now. I'd never seen anyone with high lead the way she had it. So I didn't actually know what to tell her to do about that, but the zeolite would be a good
Sure.
suggestion. Yeah.
1, 2, 3.
There are other chelation products that you can use
Yeah.
orally as well.
Yeah, I just hadn't had any experience. Zeolite I have had experience
Yeah, me
with, so
too.
I'm not.
Isn't zeolite kind of expensive?
No, it depends where you get it from.
Well, that's my next question.
From California.
Yeah, my contact. Yeah. So one thing that I want to talk about very briefly, because it's important to know it, since even though it's just us here, I think that it's important to know that when people have cavities, it's definitely a sign of chronic demineralization. When people eat a lot of carbs and they're not taking their minerals, and we have the American diet, the SAD diet, the American diet, the standard American diet. And it's important that we know that there's something that you can do about the diet. You can play a little bit with it, but don't overdo it. It's important to know that there's so much we can do when we are 30 and under, but after that, you really have to be four-handed and full-handed on your health. It's important to know that things can be redone, reversed, because the body is definitely grateful when we put good nutrients into our body, and can heal, regenerate, and rejuvenate. That's very, very important, because I've done it, and I've done it with people, with patients. So it's a matter of knowing what is bothering you. It's like she was saying about this and that. Think about it a little bit. Think inward. And your body will tell you. It's just that they don't teach us that. They don't teach us that the body is giving us signals, and that there's something going on. And it's up to us to really how did I come up with this? Because didn't want to be the little cadet to just do the cleanings and the fluoride, which I never have done, thank God, and the X-rays. And okay, Mrs. Smith, 6 months and the lady's losing her teeth and the lady's doing all this. So the point being is being proactive with not only your health, but what we do for other people.
I like that you're emphasizing that people have to take care of themselves. So when this woman that with the high lead came in, I with my Metatron, I can get pretty instant results. Like I treated somebody that she woke up this morning and she couldn't open her eye, and I gave her a treatment, and she said while I was giving her the treatment, she felt pain in her head, and as soon as the treatment was over, her eye opened. I mean, it was pretty instantaneously. So I can get results like that with the Metatron, but that's not a cure. You know, that's just a symptom relief. And so what I like about what you're saying is that really ultimately it's up to the person. It's the lifestyle is more important than anything. I mean, what you're doing really is remedial work. You know, you're taking care of problems that have come about, but they came about mostly, is what you're saying, from lifestyle and diet.
Right.
Are you saying categorically cavities are from mineral loss, or sometimes are large?
Straightforward.
All right.
No
then-
beating around, nothing.
All right, then-
It's diet related. It
Okay,
can be.
then is there, well, I take the Mountain Valley spring water that's high mineral content, and I think my diet is pretty good. I don't have that many cavities, but sometimes here and there a cavity. Is there a way, if it has to do with mineral loss, again, on blood work, is there a way to see, okay, is there a specific mineral that I might be losing, or some way to go back to see what?
Zinc is one very important mineral. Magnesium is tremendously important because you could even get a heart attack without magnesium. So that's why I mentioned magnesium. Not calcium and magnesium. Calcium and magnesium is for bone regeneration and teeth regeneration. So magnesium is in charge of like 310 functions of the body.
So once it's combined with the calcium, it's just used for that, and then you
yes.
have to take some at a
It prevents,
different
supposedly
time?
prevents colon cancer, and it also regenerates your teeth and bones, for skeletal, for your bones and teeth. But when it comes to minerals in general, they all play a role. You have copper, which, you know, when we take a lot of copper, you reverse gray hair. You have zinc, you have manganese, which is also for bone regeneration. You have chromium, which regulates sugar. There's a lot of minerals have a lot of functions. So taking minerals in water is good, but it's not sufficient. You have to eat a lot of vegetables that contain it, like celery or the greens, and also ultimately you have to supplement the diet because of the lifestyle that we have in this environment. I mean, I don't know your lifestyle, but I know that personally I'm on the go all the time. I work all the time. And so I have to always be on top of thinking. I mean, and even eating seaweed is very important because it helps you with the thyroid. It's going to protect
Once
your
a week.
bone.
You got every mineral
so-
on the planet is seaweed.
Exactly. So it's being on the ball of what you put in your system. And one thing that I always say, don't forget the high fat diet is great because you have coconut oil, which is right. The coconut oil is going to heal your intestines because it's high in capric acid. It's going to support the function of the thyroid. It's going to help you maintain cholesterol. So that alone is a great.
Is the coconut oil the best for cooking?
It's the best.
For cooking?
Yes.
Frying?
Yes, it's the best. And we have the walnut butters, we have macadamia, we have pumpkin seeds, so all the avocados. All those things are really great to embrace because that's going to sustain health. That's going to also support the health of your hormones.
You also mentioned, which we almost didn't get, fluoride. Now, I buy water, so I'm going to have a filter to try to remove the fluoride from the water, and I remove it from the water that I'm using, and the chlorine for the water I use to wash vegetables. But for drinking water, I don't even drink that. But some people claim that, okay, don't ingest it, but topically on teeth, they claim, I don't let the dentist put that on, but what's your comment on
Well,
fluoride?
according to what I've read from Rainback is that it actually makes your teeth brittle.
If they put it on your teeth?
Yeah. I've never gave anyone, not once, fluoride treatment. Never. Because what I did is when I used to work in the beginning of my career, when I worked in a clinic, I would just tell the parents the truth. And I would say, please tell them that I did. That I gave the child the fluoride treatment. I just felt, I knew because I participated in a debate when I was in school about fluoride, so I did the research. There's no way I was going to put fluoride in a child's mouth. So I never, I would never recommend it.
There's an organization, I think the name is Fluoride. No, maybe.
Wait, there's
It's
a book.
fluoride.org. I know if you give them a donation, they sent me these playing cards. It's like 52 cards, and it's regular cards, except each one has a message on it about how bad fluoride is. So I'm waiting to bring it to my bridge game, but it might distract people.
But there was a book written by, I remember his name, I always had a hard time saying his name. I was actually interviewed on radio.
Yeah, his name is Greek.
Right.
I know who you mean.
Exactly. So he wrote the book about
Yeah.
fluoride, the cancer factors, the cancer something.
Yeah.
Something like that. So,
Yeah, I used to help out with the Foundation Advancement of Cancer Therapies, and we had a conference every year, and he would come and speak at it.
Dr. Miami, something
Yes,
like
yes,
that.
that's it.
Something
Yes,
like that.
yes.
Yeah, I was interviewed with him on the radio, and I just wanted to say, it seems like there's no more questions that you guys have, but I wanted to say, young lady, that we thank you very much for inviting us, and I hope we contributed some little bit on your place and on my individuals here, our friends over here, and that you guys should feel free to call us for any questions.
It's been really informative and really great that y'all came.
Thank you.
Really fascinating.
Thank you.
And my daughter is thanking you. My daughter actually, when I called her with the good news, you're not getting your wisdom teeth pulled, the dentist up there in Burlington said, listen, have all 4 taken out at the same time, because if you have 2, you'll never go back for the next 2. That's how, I mean, I remember I had 2 of mine taken out when I was her age, actually. Yeah, it's really nasty surgery. So so when I called her to tell her, good news, you don't have to have your wisdom teeth taken
was
out.
so
No,
thrilled.
no, she didn't believe me. She said, I'm having them taken out anyway. Well, no, she's not, because I pay for it.
She
She's,
gets one taken out, she'll never get the rest taken out.
That's right. But don't
so
touch
my
it.
daughter thanks you.
That's nice.
Years ago, before I was into health stuff much, my former periodontist wanted to take out one of my wisdom teeth. And I said, why? And he said, because the gum is too high, you're not going to be able to clean it very well, and you have a pocket there. And I said, how much is a pocket? He said, 5. And I said, what? And he said, well, 5 isn't good. So I said, so you want to yank one of my teeth out? He said, well, not yank, we extract it, or whatever you call it. You know, it came there, I don't see a reason to take it out because the gum is too high. He says, well, you can't clean it. And I said, well, wouldn't it be less invasive to just cut the gum back a little bit than yanking out one of my teeth? And he says, well, we don't usually do it that way. And I said, in my mouth, we don't usually yank out my teeth. I went around a little more, and
But it's
finally,
your mouth.
and he said, well, if we did it how you're suggesting, there's no guarantee that the gum wouldn't just grow back and have a problem all over again. I said, well, but then we could see at that point what to do. So finally he saw he wasn't getting too far, and he said, well, but I'm going to have to charge you the same thing either way. So I said, okay, so bottom line is that. I'd rather, if I'm paying this amount of money, rather pay the money and keep my tooth than pay the
Which
money
one
and lose
was
my
that?
tooth. Oh, I think I also said, if you take out this one, then what about the one here, opposing, wouldn't that be fine? I said, we could take out that also. I said, now you're yanking out. This is before I knew health stuff, but I kind of knew intuitively. Why let people mess with
There
you?
you go. Yeah.
Speaking of extraction, so also the ozone dentist, I was reading an article that he had written, and he talked about a different method of extraction that he says is much less traumatic. And of course, I can't speak knowledgeably about it because I don't remember, because I guess my fading memory is from the mercury, and that's why I'm going to make an appointment to see you guys. But But it sounded interesting to me that it was a less traumatic extraction method,
Of a impacted tooth or of a regular?
a regular tooth.
Regular tooth. Yes, there is a concept. There is extraction forceps called physics forceps, which use a basic physics principle of instead of ranking the tooth left
Yes,
and
yes,
right,
he talked about that,
you
yeah.
just press and use it as a lever, and in about 30 seconds, the tooth gives in.
Yeah.
You just, okay. It's very basic principle of physics of using lever and biomediators. What's happening? The mediators in the periodontal ligaments start releasing enzymes which pretty much break down the periodontal ligaments, and the tooth comes out much easier.
And
You
so
don't-
you do that when you do an
Yes.
extraction?
So it's about technique.
Uh-huh.
technique and really things are so simple when they're found out, but until then you're
You
just
know, right. When
you're
you don't
lost.
know, it's that's it.
And once it's found out, you see, oh, it's so simple. Really, it's like makes sense. Yeah, it's true. This is the non-invasive method. Again, not many dentists know about it, and I don't know why, but this is the way I work with this method.
I'm glad I asked.
But so going back again, in his case too, in any training, in any profession, you when you go to a professional school, they give you learn science, yeah, but when it comes to helping the patient, a lot of science is not implemented. It's not even utilized. It's not utilized. But point being is, you come out with some type of basic information. Like I took pharmacology. I don't use pharmacology. I only have to know certain things just because sometimes I have to know it. But point being is, when you come out of school, you hang out the diploma on the wall. Is that it? And that's it? You know nothing basically. You have to really do it. You know, that's what took me all these years to get to where I am now. If I didn't study every day, I wouldn't know what I know.
Yeah.
It's called responsibility, and also the hunger of wanting to help the patient correctly, not to just like I don't know, you know.
I think it's like with all of us, not only in dentistry, we do service and
Exactly.
we want to help people be satisfied and work in their benefit, not just work. And this is where the connection is a little bit lost in our field, but we have to go back to that level, just helping people for their benefit and their health. Really.
You're doing it.
So, yeah.
I'm curious how insurance treats this, like if you want to have your amalgam fillings removed, does insurance look kindly on that? Will they cover that, or do they consider it a cosmetic procedure? I don't know how they think about
We don't take insurance.
We don't work with insurance, but in case you
Right.
happen to do it with a dentist who takes dental insurance, it should be done for a reason different than being amalgam. There must be a secondary decay
Right.
or something else, which this is not a reason.
You have to come up with a medical excuse.
You can't say it's because I don't want mercury in my
Yes,
mouth.
you cannot say that.
The insurance doesn't cover opinions. And they're even tougher now, because now that's like medical necessity. So once they say medical necessity, if you were a psychoanalyst versus a psychiatrist, well, you're not medical, or you're a social worker, you're something else, they can,
But if someone's having symptoms, you talked about some of them.
and it's
I
medical.
think you said, and I want to clarify this point also, you said something about it affects blood pressure. Does it make the blood pressure go up?
Oh yeah.
Yeah, okay.
Oh, yeah.
So if someone has.
But they cannot make that claim. What they could do, however, is make it some type of procedure, you know, like whatever it may be, needs a crown, whatever.
The filling has to be removed. It's
What,
looser
yeah,
or
they
whatever.
do that. They do that. Yeah, but not
That's kind of-
health related. Forget it.
I think most insurance plans don't have dental anyway.
Have to
A lot of insurance plans don't cover
Very
dental.
few people that have
Yeah,
dental.
Oh, the
insurance.
dental
You buy a
insurance
special
she's
dental
talking about.
insurance.
Yeah.
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 But there's also things with insurance on standard of practice. So if you and a lot of the people you hang out with think that mercury is bad, but the American Dental Association says, no,
They don't
mercury is
recognize it.
the
They
greatest
don't-
thing since
Yeah,
sliced
they
white bread.
don't mind
Then
if you're a dentist
that's-
that keeps
right,
putting them
right.
in now.
Yeah, standard of practice.
There are very
is
few
fine.
who do it anymore.
It's
because
cheap,
they're-
it's strong, and it's easy to work with, right?
Yeah.
Well, you don't know.
They last forever.
I don't say anything about dental cysts.
Mhm.
Or would that also, what causes them, or?
There's different types of cysts which could be related to the tooth root before development or after the tooth has grown out and was in the mouth, then the nerve died, and then a cyst can be formed around the root tip, which is the most common type of cyst. And there's other cysts which are in between the teeth, which sometimes may look they're related to a tooth, but they're not actually. So the ones that you probably are asking, or most common cyst that we find is a cyst after a tooth had a root canal or had a nerve death, let's say. The nerve died and there's a cyst forming around the root tip. The standard procedure for this is to fill the tooth with a root canal treatment, and then separate, if that doesn't shrink the cyst, then external approach is used to drill a hole in the bone, remove the cyst, and then suture it back. The success rate is also within the 70 to 80%, so this is not my favorite type of procedure. If we end up with a cyst which is not responding to standard treatment, I wouldn't do a surgical procedure called apicoectomy, but I would replace it with an implant.
Replace it with what?
With a zirconia implant.
Well,
Because I had done apicoectomies, and they have exactly the success rate that I see in the literature. Like 2 out of 10 patients will come back again with the same problem. And it is not nice to drill bone. I always feel I'm not comfortable unnecessarily drilling bone, because bone is very precious to me as a dental implantologist. It's something that is very, very valuable, and most of the time I see deficiency of bone, and I feel very bad to drill out bone unnecessarily.
But can there be cysts by a root without the root being killed or the tooth being dead?
Yes, but this is cyst which is follicular cyst. We call
Which is
it.
what?
It's called follicular cyst when the tooth has never grown out. When the tooth is still in the bone, it can form a cyst. That's a tooth-related cyst. And there's also cyst which is when there's ectodermal tissue. It's tissue which forms your skin and nails and enamel of the teeth in the bone. This is not the place where you should find this tissue, but when it's there, it can form cysts called keratocysts, which are structures which eat up bone and slowly grow and grow and grow and eat up the whole jawbone, sometimes from side to side. There are cases like that. You take an x-ray and you see empty bone. It's just a shell. You see a mandible full of just bone on the outside, and in the inside it's a cyst. These cysts traditionally are treated with surgery, and the people end up with large deficiencies of bone, big, very heavy treatment. Something that we do in Eastern Europe.
You mean to clean out the cyst?
Yeah, they remove along with bone, and they put artificial piece of mandible. This is horrible thing. It pretty much
I
creates.
actually knew someone who had that, and she was German, and she went back to Germany because the treatment was free. But it didn't work. They did a lot of hyperbaric oxygen.
Yes.
is
So
what
did
it
that
had.
work?
No.
Okay, I'll tell you what we do, and it's good for you to know it also. What we do in Eastern Europe is it's all about balance between pressure from the inside, pressure from the outside. The bone will always grow if we give it the right amount of space and force. The internal force of the body is from in to the out. So the bone wants to go out, but sometimes there is a pressure from the outside which causes it to resorb. And in this case, in the cyst case, is a pressure from the inside which causes it to resorb. So if we eliminate that force, the bone will grow back, because the body always wants to heal. It just needs a certain conditions for it. So what we do is 2 holes, 1 hole on one side of the cyst, another hole on the other side, and we wash it every day with disinfectants, and this way we eliminate the pressure.
Wow.
The thing about cysts is they create a liquid inside which creates constant pressure, and they grow, eating up bone. Once we create 2 holes and wash it daily, the bone takes over, the body takes over, the cyst starts to shrink, the force is, the direction of the force is reversed towards normal, and shrinks his back to
So
nothing.
that should work with the cyst anywhere in the body,
It should work.
except you might not be able to get to the cyst if it's internal, but the concept of,
The concept is great, and
Yeah.
it works, and it's not known. It's not known here.
So if a cyst is treated, then whatever reason why the body made a cyst, that be prone to having more cysts being made?
That's a good question. There's some of it is genetic, and then you may see, or leftovers of epithelial tissue in the bone. You may see it again. But I personally don't know what could be the source apart from genetics. So if Luz, you have a comment on this.
Usually cysts occur when there's various components. Again, mercury is actually not on the top of the list in this case. It could be intestinal toxicity, but for sure it usually is hormonal related. And I'm not talking about the one in the mouth, which cysts everywhere else is because of the estrogen, the bed estrogen. So to answer that question, I think is that you could do the indole carbonol, and that really actually shrinks it and then prevents the recurrence of it.
I think I would say about a cyst that it's like a cancer tumor.
Yeah,
So absolutely,
yeah.
if your body is producing cancerous cells that are getting out of control, to eliminate, to take the tumor out, either burn it or cut it or irradiate it, it doesn't change the body chemistry, and so
There you
the
go.
body is going to produce more cancer cells. And I would say the same thing about cysts, that if the body is a body that's producing cysts, it's going to, unless you change the ecology of the body, you will.
I had one case where the woman had cysts in her uterus, and it actually, from the blood test, they told her that they were really getting ready to do radiation and chemotherapy, and she was really scared. And when I did, I gave her the indole carbonol. Of course, I do vitamin E. It's a whole regimen, but what the main ingredient that does it is the indole carbonol. It shrinks it, and it also reverses the
What
recurrence
is
of it.
in the,
It's a combination of cruciferous vegetables like broccoli, cauliflower, cabbage, kale, Brussels sprouts, and bok choy. They sell that in the health food store. Indole carbonol.
it's a supplement?
INDOLE carbonol. CAR.
Just make tea out of it?
No, it comes in vitamins and capsules. INDOLE, indole,
I got that.
and then the second one is CARBINOL, carbonol.
Indole.
Yeah, they sell that, and then if you write one word, 3-letter word, DIM, write that word, because it's like that.
DIM?
Yeah, then you can get that in.
I know what DIM
Yeah.
I want to ask another question that we haven't touched on: antibiotics. So usually when you have, serious dental procedures, you're always given antibiotics. You have extraction, implant.
Often when I work with Luz, she's able to control it with natural means. But
Without antibiotics?
yes.
Wow.
But here I have to say, whenever the heavier the procedure, especially if bone grafts, large bone grafts are involved, I cover with antibiotics preventively as well, because
It's an
again,
invasive procedure.
I just want to use all the tools that I have.
But for an implant, you wouldn't necessarily need
Not
to?
necessarily. A simple implant does not necessarily require antibiotics when we know that it can be controlled with.
I got an implant. He did it, and I only used the curcumin. I used a lot of turmeric tablets. I used a lot of minerals. But I never let go. Two main things that I used a lot of: the curcumin. I used a lot, because you can use a lot because it's water soluble and it's very anti-inflammatory. It's also anti-cancer. But the point of preventing infection and inflammation is garlic pills, because I have this source that per tablet, each tablet is 6,000 milligrams per tablet, and I was taking 3 tablets 3 times a day.
Wow.
Yeah, and I did zinc, and I did 2,000 or 3,000 milligrams of vitamin C 3 times a day.
Oh,
And-
zinc?
Yeah, oh no, vitamin C.
Oh, C.
And when your immune system is so strong, even if you don't take anything, you will do well. And when it's not strong, even if you take a lot of antibiotics, you may still get in trouble. I see slow healing with people which are not healthy. It's pretty much, yeah. Some essential oils also have antibacterial properties.
And then, of course, the emphasis we do is avoidance of sugar, especially around the time in dairy products, because mucus producing and then sugar consumption.
I don't
That's
know if
right,
we want
chronic
any more
inflammation.
topics of getting off or if it's late, but do you want to say anything about essential oils?
Um,
Elaborate a little bit?
I use it personally for soft tissue regeneration, and after surgery, you can use oregano oil. This is one main thing, also tea tree oil, but oregano is something that I can use locally. And pretty much I leave the recovery supplementation to Luz because she's the expert.
She's an expert.
She is the expert.
She's an expert.
Myrrh is supposed to be very good also.
Which
for-
one?
More, yeah.
Oh yeah, oh yeah. I have a formula that I had myrrh in it originally, but the taste, so I eliminated. So I left it with golden seal, echinacea, propolis, calendula, and cayenne pepper, and apple cider vinegar for gum conditions. So I brought you a couple of bottles as a gift.
No! Oh my God! That's so exciting.
No, I think essential oils are
What's in there?
topical or ingested?
It actually can be ingested.
What?
This supplement can be ingested. You can swallow,
Oh
rinse and
wow,
swallow,
this is so
right?
fabulous.
And
Thank
it's,
you.
It's great for inflammation, for infection.
And you make this.
Yes.
This is fabulous.
You make stuff?
Yeah.
Interesting. So listen, I have,
This is what
I got an implant done a couple of years ago, and the dentist, when he was done, I was bleeding out my nose, so he perforated my sinus. And he said it would heal all my stuff, but instead, like the last 2 winters, I got lots of sinus infections. And I went back and got, what do they call it? Not an X-ray, but
CT scan.
the old CT scan. And it turns out that I have massive infection and bone loss in the upper jaw. And when I took it to an old friend of mine who's a dentist, and he looked at it with a couple of his buddies, and he said, you need to have 2 teeth removed and the implant, and we can save 1 tooth over there. But you have so much decay and loss. I'm on antibiotics now, and they're gonna go in and do this procedure and clean out the bone
When are you scheduled for this?
next week.
Do you want a second opinion?
Well, I'm bringing this up.
Well, there's a guy, well, I don't know if it's relevant to here, but there's a guy, Daniel Bookbinder. He works out of Beth Israel Pack by Union Square.
Mm.
And I was referred over to him as a second opinion by an oral surgeon after a dental cyst I sort of discovered.
I think we can get a second opinion right here.
Oh, okay. Well, but he's, in terms of doing the surgery and saving stuff. Do you do that kind of surgery?
Yes,
Oh, you do that?
I mean anything
Sorry.
related to that, but apparently there was a perforation. If you didn't have the problem before the implant was placed, correct? You did not have this
No.
problem. I don't see why would you remove 2 additional teeth unless
Well,
there's...
the molar in there has got tremendous decay around.
So that's a different reason. That's a different
Yeah,
reason.
and in fact, two of the dentists said that they thought that perhaps the molar, that the decay around the jawbone, the molar had actually spread to where the implant was. So,
Understood, but the peri-implantitis is usually
what do you call it?
peri-implantitis, inflammation of around the implant is within the bone and not within above the gum, and the decay that you have apparently is on the tooth, on the crown part. In any case, the biggest issue apparently is the implant because the perforation of the sinus was done
Yeah.
at the time
So
of the
there's been
placement.
migration
Yeah.
of bacteria, obviously. So I'm on antibiotics. They're hoping that that area where it's migrating through will heal during this time. And they're going to go in, clean out the bone that's decayed, and put in a graft of cadaver bone, sew it back up, give it time to heal, and then discuss implants.
Yes, that's the right thing to do, to remove it. Pretty much the problem is the connection now between the two cavities, the sinus and the oral, and bone graft should be done, but the attention should be paid just to separate again the linings on both sides of the bone separate, because even if you do a graft, if they connect, if the epithelium connects through the tissue, you may end up with a fistula. So it's just about careful job.
So I did go to see ear, eye, nose, and throat fellow that Jane found me, and he evidently did a lot of teaching. He has 7 books out, and he mentioned that same thing. And he and the dentist both suggested the same antibiotic, which was amoxicillin with something acid.
Clavulanic acid.
Well, yeah. And so that's the plan for it. So my dentist is sending me the guy he sends his children to. We go back like 30 years. So
yeah, I mean, if you have great relationship and you they're a reputable dentist, this procedure can be done by any oral surgeon.
my dentist was totally outraged that this went this far without the dentist I was seeing bringing attention to it. It's really a drag to lose 2 more teeth.
It is, and I think you should, this specific issue with the removal of the tooth should be reevaluated at least by another opinion, because the implant, there's no question, needs to go out, but if you can save a tooth, it's worth it.
One tooth that I know is gone. I just about split it in half.
Then, yeah.
Well, actually, you talked about teeth that had cracked and said that you can save them sometimes.
Yes, when the crack is not deep below the gum line, yes, it can be saved, and
So-
we do it on a regular basis.
So I
I
don't.
can send you X-rays.
Sure, we'll change
Look,
contacts
give me
afterwards. We'll give you an opinion.
Okay.
I would say, I would love to see your mouth. But one thing that I don't want to forget to say is that I definitely will be giving you high doses of vitamin C and coenzyme Q10 and vitamin D3 for sure. Vitamin D3 is very important, and I will do the indocarbonol.
See,
But not before
indocarbonol,
surgery though.
oregano and tea
I would do
tree.
that period because the body is expressing something. It's a matter of understanding that. Yeah, the procedure, something may be done without looking. We don't.
Then you have to stop. Like
Right.
a week before surgery, they told me I had to stop all those things.
I'm taking, I'm
That's what I
taking,
know.
some things act as blood thinners. But I'm taking D3, I'm taking
How
turmeric,
much D3 are you taking?
about 5,000 every 2 days.
Every day should be better.
I think you should take 30,000 every day.
I would do too, but
Do you
but
think
yeah,
that?
yeah.
I don't have an objection.
Yeah, I would do. I done 20,000. I done with patients 40,000 a day for 3 weeks, and then I see the change, and then I bring it down.
I'm using the neti pot in my nostrils
Good.
with salt,
You should do
sea
that.
salt. Should I try to use the oil of oregano, a drop or 2?
It's very strong. You should dilute it very lightly.
Like
Also, I think
500
what it
times?
is grapeseed.
How much?
Grapeseed,
Yeah.
grapes, but
Also
also
very diluted.
What's
grapeseed
it?
and chop, but also garlic. The garlic supplementation.
Can I put that in through my
No,
nose?
you should ingest it.
Oh, I have
You
no
not-
problem
don't
with that.
separate your mouth
What is
from the
that
rest.
special garlic you're talking?
It's Super Garlic 6000 by Metagenics.
Metagenics.
Yeah, you can get it only by licensed practitioner or in Wilmer Chemist because they have a.
I know Wilner.
Yeah, you can get it there.
What's this place?
It's called Super Garlic 60.
No, but what's that, Wilner?
Wilmer Chemist, 41 in Park Avenue.
Yeah, it's a good place. Yeah, that's a good
They're a great place, they're unbelievable. Place.
I'm going to turn this off if I can figure out how. Thank you.
Thank you.
Thank you.
Thank you. It was so enlightening.
So what should I